Your patient is on a Milrinone drip. The heart's pumping power is improving, but suddenly the blood pressure drops. What do? Let's break down how Milrinone works, how to monitor it, and the red flags every nurse needs to know. Milrinone is a phosphodiesterase 3 inhibitor. It increases cardiac contractility and causes vasodilation. What does that actually mean? It makes the heart pump stronger while simultaneously relaxing the blood vessels to reduce the pressure the heart has to pump against. This powerful 1-2 punch is what makes it so effective in conditions like acute decompensated heart failure and right ventricular dysfunction. You are essentially giving the heart a boost in strength and an easier workload at the same time, helping it get more blood and oxygen to the rest of the body. So, where will you actually see Milrinone being used? It's a staple in the ICU for critically ill patients who need that extra cardiac support. But don't be surprised to see it in step-down units as well. It's often used for patients who are transitioning out of critical care, or even for those on chronic home infusions who come in for management. This means it's not just an ICU drug anymore. It's becoming more common across different units, making it a medication every nurse should feel confident managing, no matter where you work. Now for the most important part, monitoring your patient. The key here is to trend. Don't just chase individual numbers. First, keep a close eye on their blood pressure and heart rhythm. Milrinone can cause hypotension due to its vasodilatory effects, and it can also trigger arrhythmias. So, continuous cardiac monitoring is non-negotiable. Next, let's talk about blood gases. While an arterial blood gas, or ABG, gives you a lot of information, in many cases, a venous blood gas is preferred. Why? It's much less invasive for the patient and still provides valuable insight into their metabolic status and overall perfusion. You can still see how well their tissues are being oxygenated without the risks of an arterial line. Finally, always follow the lactic acid trend. A single high lactate might not tell the whole story, but a consistently rising lactate is a major red flag. It can mean that despite the Milrinone drip, the patient's tissues still aren't getting enough oxygen, and you need to investigate why. Like any powerful medication, Milrinone comes with side effects you need to watch for. The most common one is hypotension, which happens because the drug relaxes blood vessels. You might also see arrhythmias, like ventricular tachycardia, because the drug increases cardiac excitability. Less common side effects include headaches or a drop in platelet count, known as thrombocytopenia. And here's a pro tip. Don't forget to check their electrolytes. Low potassium or low magnesium can significantly increase the risk of arrhythmias when a patient is on Milrinone. If you see their levels are low, it's crucial to correct them promptly, ideally before even starting the infusion to keep your patient safe. So, let's put it all together. Milrinone can be a life-saving medication when it's managed carefully. By monitoring trends in blood pressure, heart rhythm, and labs, you can stay ahead of potential problems. Know the side effects, be vigilant about correcting electrolytes, and always collaborate with your team, the physicians, pharmacists, and respiratory therapists. Whether you're in the ICU or a step-down unit, being proactive and knowledgeable makes all the difference for your patient's outcome. Now you know the essentials of managing a Milrinone drip. What's one side effect you've seen most often in your practice? Hypotension or arrhythmias? Drop it in the comments below so we can all learn from each other's experiences. Thanks for watching, and don't forget to like and subscribe for more nursing tips. Thank you for supporting my channel. Take care.